Good evening. This is the Greenfield Public Schools Special School Committee meeting. Today's Tuesday, March 1st, 2022 at 6 p.m. We are in the Greenfield High School cafeteria. A reminder that everyone who attends will be required to wear a mask and maintain social distancing. Let's move into the roll call and call to order. Secretary Ekstrom, please.
Chair Prayati.
Here.
Vice Chair Wall.
Here.
Member Deneve.
Here.
Member Martini.
Here.
Member Johnson Masad.
Here.
Secretary Ekstrom, I am here. Mayor Wiedegartner.
Here.
We have a quorum and all are present.
Excellent. Thank you. We're called to order at 6:02 p.m. I would like to make a change to the agenda slightly, just to explain. We have collected some information related to the face covering policy, which is item number 3. And we have some folks from the health department, Greenfield Health Department here to also provide some information and answer questions for the school committee. And barring any objection from school committee members, what I'd like to do is have the information provided that the superintendent has put together, as well as the health department, and have school committee members ask their questions from those folks. Both of them have childcare issues and need to go home, and we regularly, with precedent, respect our attendees as guests who have other obligations, so we would do no different tonight than what we would do, because I would imagine that much of the public would be interested in the information that's going to be provided. We will pause for public comment, allow all the public comment to happen at that time, and then come back into the agenda item for face covering policy, make a motion, and have further discussion as necessary. Can I have a motion to that effect?
So moved.
Second.
That was Member Ekstrom, and a second from Member Wall. Any discussion, any questions? I'm not hearing any. So any objections to that? Any abstentions? We'll go ahead and make that change to the agenda. And at this point, we'll proceed with, I'd like to ask Director Hoffman, and are you Nurse Tudrin? Nurse Megan? They're going to come up, and I'm sorry, we'll have to share a microphone in this space. And then, so the discussion, the face covering policy, I think if it's okay, I'll introduce where we're at, and then ask the superintendent to add anything, and then we can open it up for questions and information. So many mask mandates have been lifted across the Commonwealth, across the nation, and the city of Greenfield chose to lift their mask mandate the Friday before we went on break for a week's break from school. Timing that was abysmal and leads to a lot of confusion. And it's unfortunate that that's how that happened, without any collaboration with the school committee. So here we are tonight, where we're supposed to be having a focused agenda on a budget hearing, and we're addressing face covering policy. So I know the last time we met at our February regular meeting, folks asked to have some information provided, school committee members, from the superintendent. So I think we'll start with that. I know Christine's collected a couple of things and can walk us through what that is. And then we can also ask questions of Jennifer and Megan. Thank you.
Sure. So I have some information which honestly is very duplicative, I think, of what is from the health department. As folks know, the Commissioner of Education had indicated that the DESE requirement for masks in public schools was not going to be continued after yesterday. The conversation that was had with superintendents was related to the fact that prior to this mask mandate being allowed to expire, any district that had an 80% vaccination rate and wished to apply for a waiver could have applied for the waiver. So now that the mask mandate has expired, districts are not required to apply for a waiver for the mask requirement. The districts are able to make decisions based on their own local information or determination. So it is not statewide required in school buildings from DESE at this point. And then after the commissioner made his update, at that time, masking was required on school buses per the CDC, and since that time, that has been changed, and the CDC no longer recommends masking on school buses. They do still continue to recommend masks on other mass transit, such as airplanes and trains, but they have exempted school buses, both public and private. I have some of our preliminary vaccination rates, although I know Meg has a little bit more recent. We are able to sync data with the state vaccination database, and our nurse leader, Mrs. Savitri, prior to her leaving the district, had been able to sync middle school and high school data. So that was as of February 11th. So at that time, our high school had approximately a 53% student vaccination rate, and our middle school had approximately a 39% student vaccination rate. I say approximately because if a student was vaccinated at a federal facility, they would not have been included in the database, or if they were vaccinated out of state, it would not have sunk. And certainly, there's always the slight margin of error for technology issues when we're syncing databases. So I'll let Meg speak to what data she has for age 5 through 18 in Greenfield, because I know that's current. So
I did a count this morning of the percentage from age 5 to 18, and 47% were vaccinated with at least one dose. It's too hard to figure out if they're fully vaccinated, but most likely if they've had one, they've had another minus maybe a few. And then 315.
Sorry to interrupt. Can the public hear? Okay, you're not being amplified yet.
Move it closer.
Can you hear me? Okay. So right now, ages 5 through 18, we only have a 47% vaccination rate. The adults in the town of Greenfield, we have a 74% vaccination rate, but children, it's a bit lower.
okay, thank you. The other piece I will share that you folks have at your seats is there were 2 questions that were presented by our Greenfield Education Association, the teachers union, who represents our certified teachers and our instructional assistants. So they had done a survey and shared results with me and with you folks. So I do have a copy there. I apologize for the lack of color, but I did match the percentage response to the shade of gray for you. So question 1, would you like to see Greenfield Public Schools do regarding the lift of the statewide, do after the lift of the statewide mask mandate? 41.9% of the respondents said we should no longer require masks in school. 39% we should wait to lift the mask mandate until after break. And 19% said we should continue wearing masks for the remainder of the year. And then question 3 was related to the mitigation strategies that are in place in the schools. 31% said they would like all of the mitigation strategies to remain in place. 16% said they would like those lifted as long as we continue to wear masks. 32% said they would like all pandemic rules to be lifted. And then 20% said they think some rules need to be lifted while others should remain in place. And the comments related to that were a mix of waiting a couple of weeks, I'm synthesizing, obviously, waiting a couple of weeks past the February break to determine what the infection rate was, the question of is there an index at which point we would reinstitute masks. Some people talked about waiting until April break, 2 weeks after April break. So it really was a mix of what you see reflected in the pie chart, leave things in place or don't. So that was some additional feedback from some of our staff, and I know that you folks have seen some emails from members of the public, both supporting continuing the mandate and supporting eliminating it.
Thank you all for that summary. I'll open it up to questions from the school committee members for either the superintendent or the folks from the health department. Member Johnson-Musa, go ahead.
I just wondered if there was more you all wanted to say or present about just the general context for us, or were you're just open for questions?
So I just wanted to give you a little bit of the numbers. So the highest point the highest point in this whole pandemic was like 232 cases. And that was December of last year. January of this year, we had 1,300 cases. So we had this massive jump. So I feel like that's where people are saying, oh, the pandemic is over now because case numbers are going down. But we still have, this month alone, 232 cases, whereas last February we only had 53. So we're still 4 times higher than we were last February. I don't really have strong opinions either way on which way you go with this, but I just want to give you all of the data that, I know the news is really tricky to follow, but our cases are still very high compared to last year.
So I have a question. Oh, I'm sorry.
No,
Mayor
go
Rita
ahead.
Gardner, go ahead. Go ahead, that's fine.
Okay.
And would you please, for the month of February, because we're talking about from now forward, how many cases a week in the city of Greenfield?
This week we had 42. So 7 days, not counting today because we don't have the results from today.
So roughly 6 cases a week, 6 cases a day.
Yes, today 7 cases came in from
Okay.
yesterday.
Thank you.
And that's also only lab confirmed cases. So I did talk to a family today that had 3 people that tested positive with an at-home test, and we don't count any of those tests. So we do know that these numbers are much higher than what we're actually seeing.
Other questions? Secretary Ekstrom, go ahead.
Excuse me, I'm curious, Superintendent, when we implemented the masking and all of the other things that DESE had recommended a year and a half, 2 years ago, there were a lot of agreements that we had to make with the union. And I'm curious, if we were to lift this evening, does that have an impact on the union? And I'm sure that you've spoken with them. And
Well, they have not raised that as a question.
Okay.
So I'm
Sorry.
not aware of that.
Sorry.
And we have been in communication in terms of the survey and anticipation. As soon as the commissioner indicated he would be eliminating, the DESE mandate,
Yep.
I did reach out to GEA.
Yeah.
So we've been in
And
communication.
so you've spoken with them, and yeah, of course you have. I just wanted to make sure because there was a lot of time dedicated to how people would return to school and masks being worn, things like that, a lot of time. And so I just wanted to make sure that we've been doing our due diligence with research within the district. That's all. Sounds like you have been. Thank you.
Other questions? Member Johnson-Musa, go ahead.
A couple of questions. So with the statistic you just shared about the rate actually being higher now than it was a year ago at this time, yet you see, I think, the CDC and other agencies advocating, loosening our masking. So is that simply an acknowledgement that we've kind of reached as far as we're going to get as far as vaccinations, and we kind of have to live with COVID as being more endemic now? Or what is the reasoning behind the CDC and other agencies proposing to loosen the masking requirements?
They are saying that it's endemic now, and that's their big reasoning, is that it's not going to go away. We're doing the best that we can. Our hospitalizations are down compared to what they were in the beginning when we didn't know how to treat it. Now we have monoclonal antibody therapy and antivirals where we didn't have that before. So there are some treatments, and that's probably why they're saying that. But yes, the CDC is saying this is definitely endemic. It's not going away.
Okay, and can I ask another question?
sorry.
No, that's okay.
You did say a couple.
Yeah, I do have one more. So one thing that I'm a little bit interested in exploring is not just having an on-off switch for a masking policy, because we've seen this pandemic change over time, and so there could be another big spike. Then we have to have another big meeting. And could we institute some set points where if there's a certain level of infection in the community, we go back to mask mandate automatically? And if so, what would those markers be? I'd have no idea how to set those.
So, could you hear me? Closer. Could you hear me now?
Speak up.
Is the light on?
Just speak up.
Yep. Wow, this is awkward. How about now? Okay. So, when this all started, it was new to everybody. It was new to health agencies all over the world. And everyone was trying to figure out how to determine and monitor COVID. And a lot of the ways we were monitoring COVID were new. Just like it's new to you, it was new to all the scientists and still is today. There are different ways that we have been monitoring COVID and consistent ways that we have been following it through the city of Greenfield and other jurisdictions that are local. They're now stating that one of the better ways to monitor are hospitalizations. Now, in our community, that is pretty much not relevant because we have a local community hospital with 3 emergency ICU beds. And a lot of these cases get transferred to Springfield. So we kind of lose touch with that. Therefore, the state offered a grant that we have been awarded, and we are getting an epidemiologist to crunch all the numbers we've had since March of 2020 when we started collecting data. And we have a whole lot of data, and we still collect data. And we're going to work out with all the towns that we're working with now, ways that work for our community. It may be hospitalizations, it may be percent positivity, it may be the rate of spread of disease. But the goal for the health department at this point is, with this grant we're working on, is to have set standards. So there isn't this, what do we do now? So looking forward to the fall, we're going to have some type of guideline that we would present to the mayor and to the Board of Health to discuss and see if it works in emergency management for the city and for the children of the Greenfield Public Schools, and all children, actually. So currently, we've been following caseload. We've been following the average daily incident rate per 100,000 people, and we've also been following the percent positivity. Percent positivity is pretty consistent. Like Megan was discussing with the numbers from December of this past year, we're still higher than December, right before the pandemic really went up. So to answer your question, we are going to continue to follow what we follow. We do monitor hospitalizations. In January, when it was the highest, Bay State Franklin, now remember I mentioned 3 beds, had 11 people in Bay State Franklin daily that were critical. So, and that's significant. Today, we had 1. I wasn't sure if it was 1 or 2, because over the weekend we had 2. So I think we're going to put a lot of data together, but what works for our community and the surrounding communities together. Did I answer your question?
I think so. So as of now, with the information we have, we kind of just have to use our best judgment and do this kind of on-off switch. But possibly this epidemiologist could help us to establish metrics that could trigger changes in our masking policy in the future if we chose to adopt something like that.
Correct.
Thank you.
Other questions?
I have one.
Go ahead.
So one of the CDC guidelines, in addition to hospitalizations, most recent CDC guidelines, in addition to hospitalizations, is vaccination rate. So could you give us the vaccination rate for the city of Greenfield first and then Franklin County second? And that's across the board, so I don't know how you're doing it, age range or...
So across the board in Greenfield, it's 74%. As for the county information, I get that data weekly. A lot of the information does not come out daily. It comes out on Thursday after 5 p.m. So as of last Thursday that just passed, it was 72% of adults were fully vaccinated in Franklin County. 78% were 12 and older, and 75 were 5 and older in Franklin County. We do not have it broken down in Greenfield. And
In these numbers, when they say, there's 2 different definitions. Fully vaccinated means that they've had their first series. Up to date means that they're boosted as well. So these are fully vaccinated, not necessarily boosted.
Do you have something else?
yeah, but that's not right.
No? Yeah.
I can tell you, I know vaccination is very important. It's one of our tools. We have lots of tools. And, I keep using the analogy about Swiss cheese, like every single layer is going to provide protection. But with our cases that we've had so far, starting in January, 904 of those cases were fully vaccinated. 708 of the cases were unvaccinated. So there's not a huge difference with the vaccination rates. It's a lot of the layers all put together.
But the booster, as of Friday, that's what we were looking at each other, so it might not be accurate today, was 41% in Greenfield.
Other questions? Go ahead.
Excuse me, Madam Wall. So considering that our youngest members of the community are not vaccinated, the under 5, when that happens, do we need to be cognizant of how long it will take them to develop antibodies? Is there any idea that, does anybody know? Has anything come out about that so that we can be aware? Because there's a whole group of people that don't have access yet.
So there's a few different things. Once somebody catches COVID, they're generally considered immune for 90 days. So they're probably not going to get it for the next 90 days. But that natural immunity wanes after that. For the newest guidelines just came out today where they're extending the doses between, instead of getting Pfizer at 3 weeks, now it's 3 weeks to 8 weeks. And they say that you're going to be better off if you wait towards the 8 weeks. You're going to have a more robust response, and then you have to wait 2 weeks after that. So the whole process of getting immunized is about 3 months.
Thank you. It seems like that's an important window of time for us to be cognizant of, for the little ones.
Other questions? Member Martini, go ahead.
Some folks have made contact and asked about additional possible efforts to encourage vaccination, and I'm just wondering, are there any plans or are there any possibilities of having an additional course with the Vax bus or things like that that we have done before.
So approximately 2 weeks ago, we had the Vax bus at the John Zahn Center, and 48 people showed. And we had it posted for about a little bit over a month. And the Franklin Regional Council of Governments is using the Vax bus around, and they're pretty much seeing the same numbers, 50 people or so. So people are not running out at this point to get vaccinated. However, the Massachusetts Department of Public Health is trying to find ways to promote vaccines as best we could.
Oh, hi. So I noticed that the rate of folks who are fully vaccinated and boosted is much lower than folks who are just fully vaccinated. And it seems to me that there's probably a pretty large group of people there who is comfortable with vaccines and might be willing to get one, but might need some sort of encouragement or convenience in order to get that booster. And I wonder if there are any specific efforts about that in the works.
The state also has a program that can go to people's homes who are homebound to give vaccines, and those numbers have dropped as well. So between the city's efforts of having vaccine clinics early on, vaccine buses that have been around Western Mass and in Greenfield, as well as other ways that people are trying to have just little stand-up clinics, people are not running out and getting vaccinated the way health departments would like to see them.
Any additional questions? I have one. Why do I get whiplash from the way we change our minds about public health guidance in this country? In February 1, I was being told if I wasn't wearing this mask or stronger, it wasn't safe. It's March 1. What has changed? Walk me through it.
What's changed is that we're, like I said earlier on, we're still learning every day as we go. We've never had COVID. The closest we've had were the Spanish flu, and we're going on data from that. And they did not have vaccines in that period of time.
100 years ago, you're talking about.
Correct.
Yeah.
So we really have nothing to go by except, the day, the week, the month, the year before. One thing we did know last year was we were predicting that it would go up when it got colder, and it did. We knew that during the holidays it would go up, and it did. It was expected. So that wasn't whiplash. We were preparing for that. So I think that having masks, not having masks, I think there's also a psychological component that people are just feeling done with the pandemic. I think people are done
We can all appreciate that, of
with
course.
wearing masks.
Yeah.
And I think that, unfortunately, people just don't want to deal with it.
Yeah.
But the reality is, just like other diseases, like the flu, COVID is here, just like the flu is. And even though we might not want to contend, we still have to. But we have to find compromise, it seems. And
Okay.
I think that, the world is looking at this with the outcry of not wanting to wear masks and looking at how is disease transmitting and looking at past data and current data.
Mm-hmm.
And that's why whiplash is happening. It's frustrating for everybody.
It is, and to try to make decisions because we've been left to dry with every other level of government to know what's best for our kids, our students, our teachers. I'm struggling to understand because we function in an environment that's close together. where people touch the same surfaces all day long. And we know that by having masks on, we're not getting colds. Like, I'm struggling with how to apply what we're seeing in the larger community with what we should do in schools. Do you have, maybe that's another question, do you have any guidance around that?
I just wanted to say one more thing about the whiplash part. I think the biggest part for me is that the virus is constantly changing. So it's not necessarily us and what we're learning, but in the beginning, we had one set of virus. Then Delta came and it was a whole different story and people were really sick and it was just a different ballgame. But it wasn't spreading so easy. And then Omicron came and it started spreading like wildfire. And then we started seeing a slowdown of Omicron, but now we have Omicron, the A2. And so they're saying that one is more contagious. So they weren't sure how it was going to work with the different types of masks and things like that. But I think it's also that just the virus is continuously changing. So it depends on what we get for a variant and what we're going to do with that. And then,
Thank you.
What was the second question that you just said?
Guidance, I mean, for schools.
Oh, so I think one of the things that I have been watching really closely is the ages and what schools they're testing positive. I still call every single person that has COVID in Greenfield, with the exception of January where it just got to be too much and I would send out texts. But I call and I talk to the families. I find out where they've been and what kind of precipitated it. And then, I watch out for, like, I had a whole bunch of kids that were the exact same age. So I called the school nurse and Dr. DeBarge and said, I'm worried about this one particular grade. Are they all in the same classroom? Are they all doing the same things? So I think we are really monitoring that. And that's still very helpful that we can do that. And the nurses have been fantastic.
As long as the money keeps flowing to allow you to prioritize that, we would continue to do work like that. Is
Yes,
that
we have
accurate?
a grant. Oh, you can talk about the grant.
I think you mentioned the grant.
Yeah, it is the grant, but a majority of this pandemic was the health department solo. A majority.
Yes.
So we
yes.
didn't have these nurses start until Robin started at the end of December, and Mary Ellen started in January. So from March of 2020 till December of 2021.
Yep.
So as for money, it's not about money. Yeah, money is helpful, but the health department itself is quite powerful. And we needed
Agreed.
residents to listen, and residents did listen.
I do think the one-on-one touch, the interaction really does help on all sides, certainly it would help if I were the superintendent to know that there seemed to be, the stuff that was happening at all the same age. And I appreciate you guys doing that work. I wasn't aware of that, so thank you.
But what I wanted to mention when you
Yeah.
were talking about disease, one of the things we can notice is even though COVID's around, the flu's around, but last year, people were home more, but we can see there are, because of wearing masks, there's a lot of people that are less sick. And that's a big evidence that just having those respiratory particles are not getting in and people aren't getting as sick. And when people do get the sniffles now, they have no idea what it could be. So, when you brought up that point about sickness, it's very clear that we're not seeing colds or as many stomach viruses or as many any other virus that are transmitted. So just wanted to make that point.
Thank you.
One more little thing to consider.
Please.
Sorry, there's so much information.
You don't need to apologize for giving us information. That's why we invited you. Thank you.
So the state did change their guidelines about when somebody gets COVID, they must stay home for 5 days from the start of symptoms. So someone might say that they had symptoms 4 days before I make the phone call. So that means they can go back out to regular activities the following day, as long as they wear a mask for 5 additional days. They just did a study that came out today. We found out in one of our webinars that 31% of those cases of anyone they're still infectious after the 5-day mark. So just so you know that when kids come back to school, they are really still infectious, at least 31% of them, for that additional 5 days. And they will be required to wear a mask, even if masks are not mandated. But you have to think, like, is it better for 2 masks? Or are you okay with just 1 mask? Things like that. But when they come back to school, generally, they're still going to be infectious.
Thank you. Did you want to add something else?
And wear a mask. If they just had COVID, when they come back to school, they have to wear a mask for 5 additional days.
5 additional days, yeah. Thank you. Other questions from the school committee for our public health folks? Thank you for being here. It was super helpful. We appreciate it.
I was going to say what you're saying. I was going to say thank
Please.
you.
Member Johnson Musad would like to thank you.
No, yeah, I mean, for coming here tonight, but I mean, for everything you've been doing since the start of the pandemic. It's
Absolutely.
intense, and you've been working
Absolutely.
very hard for us, so thank you.
Thank you.
Thank you.
We won't make you stay for the rest. I'll text you later. So we will go into public comment at this time. I know that Susan Farber over here at the front table, our recording secretary, is keeping a list of people who have asked to speak. The way public comment always works is you come up here to the microphone, state your name and the town that you live in. You'll have 3 minutes to speak. We do time you. I'm going to ask one more time. We still have a policy in place that you wear a mask in school buildings. Just like any other school policy, I expect that you respect it. It's about respect for our school environment and the policies that we have in place. I will also remind the public that we want to hear what you have to say, but public comment also happens at the discretion of the chair. And if you're unwilling to put on a mask to come up and make your comment, you will not be allowed to make it.
Can we object to that?
So, like I said, any other rule that we have, you would respect our rules. It's simply about respect. Susan Farber, can you call the first person, please? Susan Farber, can you call the first person, please? Thank you. Just state your name and your town and your 3 minutes.
Mike Kacheski, the athletic director, teacher, coach here at Greenfield. I'm also a parent of 2 students at GHS. Excuse me. And I just want to talk about, and since I haven't been here in front of the new council, I wanted to introduce myself, tell you all about the good things that are happening at GHS and Greenfield Middle School. We just ended our regular season for the winter sports. We had a ice hockey Western Mass Championship in Class B, and our boys basketball team is seeded 17th in the state tournament, and they will be playing on Friday night against Salem Academy in Salem, Massachusetts. Our ice hockey program is playing in the prelims, which are ranked 32. They're going to be playing Gardner High School tomorrow night at 6 o'clock at the CMA, which is CMA is Collins Moylan Arena. And I just want to let you know all the good things that are happening with our athletic program, and I would like to take any questions you might have about us and what we're trying to do and positivity in this school and bring all the respectful things that we like to bring to GHS. That's basically all I wanted to say.
That's awesome, Mike. So during public comment, we won't comment, but we would love for you to come back next week and talk to us about the athletics.
Well, see, this is time consuming. This is when I could get in here. I saw this meeting, so it's good. I would love to do that. Anything that I can talk about athletics and help anybody out with any of our stuff, I greatly appreciate it.
Thank you, Coach.
All
We
right.
appreciate you. Good luck to everyone. Way to go, Green Wave. Who's next? Susan Farber? Brendan Leowolf. So you state your full name, the town you live in, and you have 3 minutes.
Hi, everybody. Can you hear me okay? My name is Brendan Leowolf. I'm a resident of Ashfield, but I teach here at Greenfield High School. I teach filmmaking, I run the AV Club, I run the district's film festival, and I'm advisor to the 9th grade class. First, I just think we should let all the people speak here. I think that's really important. I just have to speak on behalf of my unmasked neighbors here, that it's important that they have a chance to speak as well. My job has been made really, really difficult by some of the policies you've put in place in spite of your best intentions to do the best you can with the knowledge you have. But it's been really difficult. Teaching remotely was absurd. Teaching wearing a mask all day has been so challenging and made me not want to be a teacher. But I think the kids actually need a reasonable adult in their lives who can continue to look out for them in spite of the layers of absurdity being handed to them. COVID is endemic. We're going to be dealing with it forever, and we cannot wear masks forever. We're told that they prevent the spread of COVID, and it's mostly untrue. The only 2 randomized controlled trials run worldwide have both shown no statistical significance of wearing cloth masks, and one of them showed really minor significance of wearing surgical masks. We have to follow the science on that. Even N or KN95 masks actually require a ridiculously tight fit and are much less effective when you're taking them on and off to drink water on a regular basis. Really, studies compared forced masking and optional masking districts in Tennessee found no difference in case rate trends, as did one from Florida. One from Cass County, North Dakota, actually found lower prevalence of COVID in mask optional districts. The UK also has data showing no statistical difference between masking and mask optional schools. Not to mention the 3 times a day, we have 150 students in this room for about a half hour at a time eating lunch. In spite of the fact that we're limiting 6 kids to a table, there's still 150 people in here without their masks on. And we do that every day. They're all exposed to each other. Why not just let them be the way they are the rest of the day? Many school districts around the country, as well as most of Europe, have been mask-free for months with no major differences in their outcomes from places where masks have still been forced on kids and staff. And to those worried now, they're going to be needlessly exposed. You're really already exposed in your daily interactions, as the masks are not doing what most people think they're doing. They're really a symbol, a signal, and little else. Finally, for this minimal, if any benefit at all, there are major costs to masking. Just this week, Business Insider estimated the world is throwing away 3 million masks a minute. That's 3 million a minute. That's mountains of non-biodegradable garbage that is filling our landfills, our playgrounds, our parking lots, and the hallways of the school. Mental and social emotional impacts have been harder to measure, but studies from Italy and Greece, as well as anecdotal evidence of anyone working in this building or any school, can show masking is a barrier to speech recognition, hearing, and communication. Masks impede children decoding facial expressions, reducing perceived trustworthiness. I've heard countless teachers describe their unique struggles this year in making connections with students. I encourage people to read the work of epidemiologist Dr. Vinay Prasad of UCSF, as well as Dr. Lucy McBride of Harvard and Johns Hopkins. Their group, The Urgency of Normal, prioritizing a return to normalcy for our kids. They are the lowest risk group who is borne the highest burden. It's unfair and it's wrong, and we really need to change it as soon as possible, ideally yesterday. Town has made it possible for adults to be a part of their community mask-free, and I really think we need to make it happen for kids too. Thank you so much for hearing me out.
Thank you. Who's next?
Chair Prayati, I'm not sure how to proceed because I do not know who will be allowed to speak or not, if they have masks or not.
If anyone has a mask and would like to speak, they can come up and speak. You don't have a mask on. I'm going to ask you to be respectful
Your
as
policy
I've...
has to line up with law.
No,
And this is a sad attempt at your attempt to control.
Do you adhere to city
Good
council
evening.
policies?
My name is Carissa Clifford, and I'm
I'm
a
afraid
resident
that
of
we can't hear your
Greenfield.
comment as you do not have a mask on. I appreciate that you're
regarding
having
the vaccine passport,
It's
which was
unfortunate
intended
because she
to be
isn't
a
permitted
standing
to speak.
policy in Boston.
The chair identifies who is able to
Mayor
speak.
Wu
Okay, we're
caves 5
gonna
hours
stop
after
public
constitutional
comment at this
attorney
point.
Richard C. Chamber files federal lawsuit. February 18th regarding the vaccine passport, which was intended to be
I
a
move that we
standing
take a
policy in
5-minute
Boston.
recess.
Quote, Mayor Wu
We're going to take a 5-minute
caves
recess.
5 hours after constitutional attorney Richard C. Chambers
I'll ask
files
you to be
federal
respectful
quote.
of the meeting that's in process.
No, stop.
I have not
I'm
once
giving my
been
comment.
disrespectful of you.
Policy has to follow in line with the law.
I would ask you to
do
put a
not
mask
have
on
the
if you're
law.
going to comment.
It's not, you don't, let go of some of your power and control.
Can I have a
It's
second on my motion?
Your
Second.
policy has to be in line with the law. I'm sorry, Amy. You probably will end this next week. This is ridiculous. You're being ridiculous. Let me continue. I'm going to start my 3 minutes over. Good evening. My name is Carissa Clifford, and I'm a resident of Greenfield. February 18th, 2022, regarding the vaccine passport, which was intended to be the standing policy in Boston. Quote, Boston Mayor Wu caves 5 hours after constitutional attorney Richard C. Chambers Jr. files federal lawsuit, end quote. First, let me say that a friend of mine who works with that attorney informed me that you, as school committee members, actually have no legal authority to impose a mask or vaccine mandate. She gave me the law number and chapter that's being cited incorrectly and giving you the authority, hence the suit was filed against Mayor Wu. It's section MGL section 111, chapter 30 and 31. Maybe you believe you have the authority because you're viewing the mandate as a policy, but policy has to be in line with the law. I'm not even sure you have the ability to set policy, not because you shouldn't, but because you've abdicated your authority to the NGOs and the unions. One of your committee members said as much in a letter to a resident who asked about ending the mask policy. She said, oh, if it were only that simple, there are hundreds of people involved in the decision process. That may sound normal to you, but it's absolutely terrifying to me. Union leaders, NGOs, and non-governmental organizations have more authority to determine how the Greenfield school system is going to operate than you, whom we elected. You may have willingly or maybe unwittingly handed over your power to them, and that's not going to work for this. In my last statement, I asked you to stand up to the powers that be. We need you to be strong. Stop kowtowing to the unions and NGOs. They don't care about you, and they don't care about our children. Money, power, and control is the name of the game. Governments, education unions, and NGOs are so power hungry that they've spent untold amount of money on attorneys to add, change, or omit words in the written policies in order to convince you and even the general public that they had the legal authority to max and vaccinate us. State leaders have given a little leeway by saying after X month you can decide how much longer it lasts to give you some semblance of power. And apparently that is important to you to hold on very tightly to. You can't point to a law that says anyone has the right to make anyone else wear a mask or take any type of medication or vaccine because there is no law. You're getting away with it right now because people up until recently in Massachusetts haven't been challenging it. But now the winds of change are blowing, and trust me, we'll all be better in the end because of it. I've run out of time, but I'd be happy to discuss the precedent set by United States Supreme Court in Jacobson v. Massachusetts in 1905. That's the law. Your policy is not the law. That's the law. Thank you for your time.
Oh, gosh, we're cutting off public comment if everyone left is unwilling to wear a mask. We understand what your position is because you refuse to put a mask on. And public comment is now done. It's at the discretion of the chair.
Hello.
And I'm going to ask you to... Public comment is finished. I'm going to ask you to leave.
But I still have a voice. So
I'm going to ask you one more time. I will come and turn the mic off. I'm going to ask you one more time to leave the table. Public comment is at the discretion of the chair, and it is over. We're moving on to the next item on our agenda.
this is our time. Just keep talking.
We welcome your recall effort, sir. I have said that at almost every meeting in 3 years.
Chair of the meeting, after a warning.
The chair
reserves the right
has
to terminate
ended
speech
public
not
comment.
Constitutionally protected because it constitutes true threats that are likely to
when
provoke
I
a
get
violent
upset, I'm
reaction
upset.
and cause a breach of peace
You
or
are not my
incitement to
child's
imminent lawless
doctor.
conduct or
You are not
insanity
licensed to
obscenities.
practice medicine. You have no right.
Do you follow town council rules, policies?
Excuse me, Mike, let me finish.
council policy?
I follow the law.
I'm sorry?
I follow the law. You know the
So,
Constitution?
I'm familiar with it.
You are not my child's doctor, and you are not licensed to practice medicine. You have no right to tell me what is best for my
It just shows how weak you guys
How about
are.
that 5-minute recess? You do not work for the department.
Call for a 5-minute recess.
Or even our local board of health, for that matter.
So public comment is now ended. At the discretion of the chair, we're going to move on to our next agenda item. I need you to allow us to go on with our meeting. You can leave the table and we need to go on with our meeting. I'm going to ask you one more time. You're interrupting our meeting. We have business to attend to. And we do this portion at the discretion of the chair. I'm going to ask you one more time. You are disrupting a public meeting. I've already ended public comment. Please leave. Please leave the table.
With that said, this is a virus that sickens adults.
I need you to stop and leave the table. Public comment, that's correct. And we have business to do, and we're unable to do our business because you will not leave. I'm going to ask you one more time. Public comment has ended. You can get up and leave.
You're right, I can. But I won't, because you need to hear what I have to say.
Sir? Public comment is at the discretion of the chair and not required at any meeting. Please leave.
Well, then why don't you make my public comment for me, since you know public comment is over? I didn't sign up for it. Anyway.
Please leave.
Per school committee
Please
policy,
leave.
PEDH, public comment will be governed by the following rules. Topics for discussion should be limited to those within the school committee's scope of authority. The chair of the meeting, after a warning, reserves the right to terminate speech which is not constitutionally protected because it constitutes true threats that are likely to provoke a violent reaction and cause a breach of the peace or incitement to imminent lawless conduct or contains obscenities.
Okay.
We've already been threatened by a person who is sitting at this table. But you are not.
You are not operating within our rules. Public comment has
We have
ended.
a policy.
Please leave the table. Please leave the table because public comment has ended. I'm not sure how many different ways I can ask you to leave. Can I have a motion again for a 5-minute recess?
So moved.
And a second?
Second.
Any abstentions? Any objections? We're recessed for 5 minutes. Please turn your microphones off. Can I get a motion to adjourn?
So moved.
So moved.
And a second?
Second.
All those abstaining or objecting? I see that as a unanimous motion to adjourn. We are adjourned as of 7:08. Thank you all for being here.